My name is Zanthia Oliver. Welcome to the Zanthia Oliver Show. Today we are here to discuss some things in reference to heroin and fentanyl. I've been to several funerals, a lot of funerals this past year, and quite a few of them were related to overdose. So I want to educate myself a little more about some of the drugs. So today I have the Lieutenant Governor here, Bethany Hall-Long. Thanks for coming.
Thanks for having me.
And also I have Sandy Givney here, who is a nurse, and thanks for coming. So we're going to get straight to the point. And y'all, how y'all want to jump on, whoever wants to answer the questions. But one of the first questions would be, what are the signs and symptoms of heroin overdose?
Well, you know, it's funny. They get us mixed up all the time. Sandy's actually the doctor. I'm the nurse.
Okay.
But we're going to kick it to Dr. Givney, who is here locally in Wilmington. We spent a lot of time together on the street. So, Doc, why don't you start with that? And it's serious. And thank you for sharing. I know you called me. Your heart was broken. So many funerals. And the only way we're going to help families is to get services. So thank you, Zanthia, for taking the time of having us. Doc, you want to answer those?
Yeah, sure. As an emergency physician for 26 years, you know, we've seen a change in the type of drugs that are on the street and what people are utilizing to kind of get out of their worries and sorrows and mental health issues. But certainly fentanyl over the past 5 years has changed the landscape. Fentanyl is about 100 times more potent by body weight or by grain than heroin. Mm-hmm. So simply said, 10 salt grains of fentanyl can stop an individual from breathing. So imagine your salt shaker and you have 10 grains of salt come out.
Just that little.
Just those teeny little things. That's enough to stop someone from breathing with fentanyl. Whereas heroin, less potent, the effects of it less devastating, but what we're seeing with fentanyl as well is that it's being placed in other substances that folks normally would not expect to see it. So, for example, a marijuana, a blunt, even in cocaine, it's mixed in there because the dealers or those that are selling this realize that once an individual experiences it, they're liable to crave it again. And they're liable to go back and buy more. And some of that has to do with the withdrawal state, but some of it has to do with the addictive nature of that substance. So fentanyl, really bad actor.
Okay, now let me ask another question. How can you stop a heroin overdose?
Well, Sandy and I brought today with us a couple of kits that everybody should have. Or if you know a family that has someone who is using opioid prescriptions, or a church organization, a community club. Sandy and I have been walking. Last week we were walking along the street, came across a lady who showed those signs and symptoms. And I'll have Sandy talk a little bit about those signs and symptoms in a minute. But right here, for free in Delaware, we can access through our Delaware Help Is Here program and calling 211. You can get our opioid rescue kit, or all of our pharmacies, you can purchase over the counter something called naloxone. Sometimes you hear it called Narcan. I'll have Dr. Givney show you the type that she and I like to use in the community because it's a little easier. It's like a nasal spray.
Okay.
We can get you a kit, put it together, and all you have to do, Zanthia, is simple. Shake the person, are you okay? If they're not and they're out, if it's alcohol, diabetes, you just have to spray it up the nose. And again, you would always call 911. This is called Narcan. We would be happy to make sure at the end folks know where to get the kit for free. And we'll make sure that y'all have that. And Dr. Givney, why don't you share the other type that you sometimes use? And
So Bethany and I are on the street, and Zanthia, you've been with us more than one time, walking the street, seeing what's out there. And we realize that oftentimes we have to get to people where they live. They may not come to us. And that we go with love and open arms to say, hey, we're here to help. But we offer two different types. They both do the same thing.
Okay.
This particular type here is 4 milligrams of naloxone or Narcan. It is so easy because all you need to do with this or the other kit is put it up the patient's or the person's nose and push the button. So you'll watch this fine mist come out of the top. I take it out of the pack. It's like AIRING nasal spray.
Wow.
And within 2 minutes, a person that is suffering an overdose is reviving and breathing again on their own. It's the difference between life and death. You have about 6 minutes, Zanthia.
That's it.
That's it. After that, the individual will suffer irreparable brain damage and oftentimes will never be able to wake up and speak to you and be the kind of person they were before it happens. And that's a tragedy that is easily remedied if folks that know people that are struggling have this in their home.
Well, I'd like to thank both of you because I know y'all are constantly walking the block. Y'all been on the east side with me. We worked on the north side, and it was interesting to see how many people were happy to get these kits. And the very next day, the gentleman knocked on my door. He said, do you know a guy OD'd down on Pine Street, and because of the kits that y'all gave out the day before, we were able to bring him back. So that's the type of education we need to put out and let the public know that these kits and they come in handy, especially if they're free. If you have a family member or friends that have some type of addiction, I think it's best to have one put in your house. And later on, we will have a telephone number, like you said, 211, if you're interested in getting a kit. But let me ask you another question. What are some of the solutions to this problem?
Wow. And you really hit on that. And again, the state and federal government have been happy to provide the funding behind the kits. The reason we need to save folks is because people are suffering with the coronavirus now. We've got our masks, we're socially distancing, we're doing all those right things, but we're isolated and we're alone. Prior to even coronavirus, people with unemployment, worries, anxiety, people are afraid to talk about how they feel. And it is okay, Zanthia, to not be okay. Dr. Givney and I see this all the time with our behavioral health consortium that the governor had started 3 years ago. We've got great leaders in the community who are working on getting people treatment. Everybody in the city, everybody in your community should not worry if they can't pay or even if they have insurance. We want them to come and get services. People from all backgrounds, whether you're got a lot of money, whether you don't have money, whether you're white, you're black, we all suffer alike with conditions of depression and anxiety and worry. And a lot of times we turn to street drugs to feel better. Some of us have had more trauma, have been around gun violence and family abuse. We can get you help. And if you call 211, we have the mobile crisis number. We can get services to avoid having to go to see Dr. Givney in the emergency department. But we also have community clinics and resources that will openly see folks. And if you've got a problem, Delaware has implemented through our Department of Substance Abuse and Mental Health bridge clinics. So if you are to call, they can coordinate and work through with a loved one. If they are addicted and they need detox, working with employers. And let's face it, we spend a lot of time meeting people when they come also out of Gander Hill or Young facility, when people have been incarcerated. It's a challenge. So we are there, and we'll make sure you have some of those phone numbers and resources at the end. But the first start is acknowledging them.
Okay. One of the other questions I think we spoke on earlier, like you said, about the mental health. When you discuss the mental health aspect of this, what would you say about the mental health?
Well, with the mental health piece, we have a lot of different providers around, whether you talk about Brandywine or Wilmington, clinics, Henrietta Johnson. Folks can go now, and when you go to LACC and you want to get some testing for COVID, we have people there to talk about how you're feeling. And at Kingswood, we're over there. Right. We're in the centers. And Dr. Givney can also probably chime in. She chairs the Access and Treatment Committee for the Behavioral Health Consortium. And we have people who look like each other too, because sometimes, somebody's young, or you've got a grandbaby or a great-grand that you're worried about that's on the street. We have people who are young. We have young counselors. We have folks who look like you to help.
Good. How often do you come out with the van? I know I was on a van one day with y'all. How often do y'all pull the van out?
About every 2 to 3 weeks.
That's not bad.
No.
So you're downstate and plus you're upstate.
We go where the need calls.
Okay.
And where we feel will be most effective.
Okay.
But I will tell you that Bethany is spot on about how to deal with the underlying root cause of a lot of this. And oftentimes it's bipolar depression that has been undiscovered or not realized. And those folks have voices in their heads, or they just can't stop their thoughts. And for that period of time, oftentimes drugs becomes a little bit of a solace, but soon it turns into a rabbit hole nightmare. Okay. So if they don't, I've had many friends and colleagues that have struggled with unknown bipolar disorder, depression, major depression, unresolved trauma from a childhood, and those people oftentimes turn to substances.
Okay, what would you like to say in wrapping up?
Well, I would just say, if you know someone, whether it's alcohol, heroin, fentanyl, very deadly, that are on substances, or mental health. If you're elderly at home, alone, depressed, working in the community, call us, 211, the helpline. We can get you free service, and make sure everybody has a kit. They're easy to put together. You will save a life. We will get treatment for the person. So thank you, Zanthia. Thank you for your hard work and your leadership in the council district. Really kudos to you.
Thank you so much.
And Zanthia, I'm going to put you on the spot and say that people can also reach out to you, because you make things happen. Sure. You're a leader in this community, and that's why we look to you as well to help us with this. So if there's a place that people want us, their church, their community, their sidewalk, that they feel they need us, if they reach out to Lieutenant Governor or yourself, we'll be out there. We want to meet people where they live. And as Bethany said, it's okay. Right. It's okay. It's a no judgment zone. We're just here to help.
And I like that. Like you said, this is not about male, female, any color. Addiction is an addiction. And, it's everybody's in a common place with that. So I just like to thank you both for coming out.
Thank you.
And we're going to take a break and come back with another few guests. Welcome back to the Zanthia Oliver Show. I'm Councilwoman Zanthia Oliver. I represent the 3rd District. Today we are here to discuss some drugs that are rapidly hurting our community, which would be heroin, fentanyl, and some other things, some other drugs, I'm sorry. So for part 2, we have Johnita Davis, who is a supervisor, and we have Elosha Anderson, who is a nurse. So I'm going to ask you a few questions, and we can kind of piggyback off each other. I guess my first question would be to you, Johnita. What do you see the problem being in our community as far as the fentanyl, the pills, and all the drugs that, like I earlier I stated, I've been to several funerals, quite a few funerals this year, and most of them were overdose. And I'm just trying to educate myself and educate the community on some of the drugs that's out there that's plaguing our community.
So what I would say is a lot of our community, they're not educated on the drug that they're taking. They don't know where they can get help. They are mixing different drugs together and not really knowing the effects of them. So you mix drugs together, you don't know the effect, then you have the overdose that comes. So really, I would probably just say being educated about the drugs that are out here in the community right now.
In the field you work in, do you see? It's not no white, no black. You just see numerous of various cultures coming through.
Absolutely, we see all cultures come through, all walks of life, rich, old, poor. It doesn't matter. It's affecting everyone.
Okay. Elosha, how do you feel? I know you're right out there in the community. I know your mother Sandy's been working this field for years. She's a tremendous person. How do you feel and how do you see this epidemic that's occurring in our community?
I feel as though they lack education. I mean, we have detox. That's where we are right now. And detox is where you're going to detoxify your body from whatever drug that you are using. So once you detox for those 5 days, there's the next level of care.
Right. What's the next level after the 5 days?
The next level of care would be rehab.
Okay.
So now you want to rehabilitate your body. After you detoxify your body, you want to rehabilitate your body. It's just like somebody getting in a car accident, you break both of your legs, and you're laying in the hospital, just say for 4 weeks. After you're in that hospital for 4 weeks, you go to a rehab to learn how to walk again.
Makes sense.
So just to piggyback off of what she's saying, they lack that education. They may come to detox for 5 days, but they need to then rehabilitate their body back to normal.
Let me ask you another question that you said about the detox. Where can they go for detox here in Wilmington?
We have one detox in Newcastle County, and that's on Kirkwood Highway. If you have mental health issues, they do have Rockford Center or Meadowwood.
But you have to have insurance.
Okay.
So we have nothing in the inner city.
That's what I'm saying. That's what I wanted to hear.
Right.
We have Brandywine Counseling, which is not a detox. It's a methadone clinic. But we have nothing in the inner city.
And I think people get that confused. I'm glad you said that. So Brandywine Clinic is not a detox.
No. It's not a detox.
Okay. It's just a
It's an
methadone.
outpatient treatment.
Okay. So can using heroin once make you addicted?
It can, yes.
One time?
One time, absolutely, it can. You never know what the effects it will have on your body. Elosha probably can speak more to that on the nurse perspective, but you absolutely can get addicted after the first time.
Wow.
Yeah, everyone's affected differently. Some people withdraw differently. Some people go through withdrawal. Some people don't go through withdrawal. With the fentanyl, though, I've been at detox maybe about 8-9 years. And in the last, I'll say about 3 years, there's been so many overdoses due to the fentanyl that is put in the heroin. So I might do an admission. I might do 4 admissions, and 3 of them might not know that they have fentanyl in their system.
Wow.
So
what are they lacing it with? They're lacing the heroin with fentanyl.
Yes, Absolutely. They're putting fentanyl in the heroin. So there's no more just pure heroin coming through our building.
Okay.
Everybody has fentanyl in their urine if they're using heroin.
Wow.
Now, also, we could have somebody that comes in just for alcohol and they can say, they had cannabis abuse, but fentanyl is turning up in their system.
Wow.
So it's also laced in the marijuana as well. So
the fentanyl's in the marijuana?
Absolutely.
Yes.
Absolutely. It can be laced in anything. So people think, I'm not doing any opiates, fentanyl won't get me, but it's laced. It can be laced in anything.
So speaking to that, so when you walk past and you smell this marijuana that has this bad smell, that could be because it's laced with fentanyl,
It could be.
possibly?
It could be.
Wow. So when they come through, y'all giving them pamphlets? How are you educating people?
So when they come through, detox is a 5-day detox. So each day that they're there, they come and they speak to counselors.
Okay.
So on day one, they talk to a counselor and they talk to them, what's their next level of care? Do they want to go to rehab? Do they want to go to outpatient? Do they want to just go to meetings? So we at Detox, we push that they do go to rehab, because a lot of times people just want to come in and detox their body, but that's not enough. They need the further education. Sometimes they have mental health issues. So just having a whole package, going to rehab, we definitely push that.
And where's your facility located?
We are on Kirkwood Highway, 3315 Kirkwood
okay.
Highway.
Okay. Do y'all work with some outside agencies? I know Aaron Moore used to take some people to Philly. Do y'all have like a building up there? Not your building, but do y'all have a person that say, look, I want to go to treatment. Could you refer them to a place in Philly? Or, where would...
So we Northeast Treatment Centers is based in Philly. So if we have someone that they want to go to Philly, we just refer them to our sister basically company up in Philadelphia, and they can get them somewhere in Philly.
How long will it take? Excuse me. How long will it take them? How long will it take them to get admitted? Just say, do they have to wait a week? I'm just wondering if a person's interested in going to rehab and they have to wait a week.
So if they're here in Delaware and they want to go to treatment out of state, no, the counselors, they will refer them.
Okay.
It will be there 5 days. So after their 5-day detox, we usually transport them, or they will come and pick them up, and they'll go from there. So it's just the 5 days.
Okay. Now, Elosha, I know you're out in the streets as myself, and we see a whole lot of, various people, all stages of life. And when I see these, the kids walking around just nodding and just looking like zombies, is this all of the pills? What would you say? Because it's baffling to see all of these addicted kids. What is the rise on the kids with all of this heroin?
Well, I live in the inner city, so I see the overdoses. I see the overdoses, and I see them nodding out.
Right.
I don't see those same people coming through detox.
Mm-hmm. Okay.
I see, some people come through detox, but I don't see them, the ones I see in the inner city, not too many of them coming through detox.
Mm-hmm.
So 9 times out of 10, they're uneducated. But then even more, it's nothing right there in the inner city. Right. We don't have a detox. We don't have a program as, they have a Hero Help program in Newcastle County, where the police officers, they will come out, go door to door for the people that overdose that week. They have a list of people that overdosed that didn't die.
So do they come out and give them kits, or just they come out and educate them?
They come out, educate them, knock on their doors, see if they want to go to detox, see if they want to go to treatment.
Wow. We need that here in Wilmington.
We don't have it in Wilmington.
Okay.
So what I was going to piggyback and say, one day we were kind of dead in detox. So Elosha, myself, and another nurse, we said we were going out to the inner city so we can find some people to come to detox. And I think it surprised us all because they weren't educated. They didn't know where detox was. Of course, some of them, they weren't ready to go to detox. So I think just having somewhere where, it's close, it's in the inner city, that they can go to, that they're familiar with, we probably can see people get clean much more.
So detox is on Kirkwood Highway. Do y'all have a van where y'all would be able to pick up people, or people just that
We do have a van.
You do have a van? So you do have an outreach where you can ride around and maybe say, get on the van?
Yes.
And how many days a week do you come in the city?
Maybe like once a week.
It's not bad. We could do better. Hopefully, Lieutenant Governor was just on. Hopefully, she said hopefully y'all will follow up. And I know y'all have a building here in Wilmington. Hopefully we can find some funding to get some treatment here in Wilmington, because it's a lot of people who are on heroin, fentanyl, opium. I walked through the community with the lieutenant, with Sandy, and I know we had over, I guess, 100 kids, and they went like this, and people were very receptive to taking them. And like I said, we were able to save a life because someone knocked on my door the next day and said a gentleman had OD on Pine Street, and they were able to bring him back. But I think with everybody is saying the same thing. We have to be educated. We need to know what's going on. You need to know there's treatment out there for everybody right there on Kirkwood Highway. If you're interested in these bags, they are free. Call 211. And if you have a family member that has an issue, don't be afraid to pick up the telephone and call and ask for some help.
Absolutely.
Anything else you want to say, Elosha?
I could just let them know that Detox is on Kirkwood Highway. We're at 3315 Kirkwood Highway. The phone number is 302-691-0140. If you need help, we're always open 24 hours of the day.
And also, if you do not want to come to Detox, you can call, you can ask us questions, and, whatever we can do to help, we certainly will.
Okay. One other question. What is the difference? What is heroin, and what does it feel like do people come talk to you about that? I mean, I know y'all wouldn't know how I feel, but
It's an opiate.
Okay.
So basically, it's a downer.
Okay.
Like I said, the heroin is not just heroin anymore.
Wow.
It's mixed with fentanyl. So we don't know how much fentanyl is put into that little bag. Mm-hmm. So it may be 90% fentanyl in that bag with 10% heroin, or it could be 10% fentanyl with 90% heroin. We don't know. The doctors don't know.
That's why it's a rise in the overdose.
Right. So, yeah, that's why you'll see somebody instantly, as soon as they shoot it up, they might pass right out and overdose.
I see a lot of that, not overdose, but I see a lot on the bags, like over on Market Street area, 20 over by Milton's old liquor store. When we did a cleanup over the Northeast area, I mean, you could just see the blue bags, white bags everywhere over there. So it's all throughout the city. I mean, you see it on the east side, you see it on the north side. So I think that is something that y'all could discuss. Maybe, well, you're right here, maybe bring the van out more often. I mean,
Absolutely.
I represent the 3rd District. Feel free to give me a call. I'll take a ride with you and ride around in the community, and I can help you get some people, hopefully, on that bus who want to come to Detox the next time it's slow down there.
You will really be surprised at the people that do not know that they have fentanyl in their system. Mm-hmm. When I show them their drug test, it's like, what? Mm-hmm. I didn't use fentanyl. It's like, you don't know what you're using. You're buying a blue bag.
Right. And now with the pills, how, now I know a lot of people who overdosed on the pills, how do they don't know the difference in these new pills? They're making them, they're recompressing them, or?
I haven't seen the pills, but I've heard that they were making fake pills.
So the
I'm
fake
not
pills with
sure
fentanyl, and the fentanyl
They
can
probably
kill
have
you.
a little bit of everything in them.
Wow. I just want, I'm just glad y'all were able to come on, and we need to have these discussions more. We need to really educate our people. Like I said, hopefully you'll come through with the van. And if y'all have any literature, we can start giving that out, when we're out and about. We know the numbers to call. What are some of the solutions that you would say? What are some solutions to this problem that you could think of?
Educating the community, getting out there, giving them buildings that they can access.
Okay.
Giving them, all the information that they need, and not just, giving them the clinical side. Just really talking to them, coming down and letting them know how it is, really.
Now, how do they follow up after they have been to the treatment? Just say they've been to detox, they did this. How do y'all follow up with them?
Okay, so I can break it down like this. The hospital is a 4.0 level of care. Detox is a 3.7 level of care. Rehab is a 3.2 level of care. So after that, you've detoxed, you've rehabbed, then you have the 2 level of cares that's like outpatient and
It's like outpatient, IOP.
like intensive outpatient. So they would still go to meetings, groups.
Okay. Okay.
You know,
Like
they
AA or something.
AA,
Okay.
NA.
or they might need that that crutch, which might be Suboxone, Subutex, or methadone.
Okay.
Some people are just not ready, and they might need that crutch.
I see where you're going.
So some people are being treated in the rehab with
Okay.
Subutex. So you don't have to just cold turkey it or just get dosed all the way down right away. If you're not comfortable with just not having nothing, they do have, they will prescribe something.
Okay. So do you have any final things that you'd like to say in general?
Just whatever we can do to help. We just want to educate the community. Just know that we're here. They're not out there alone.
I appreciate that. Would you like to say some closing words?
I just want to say, hopefully soon we can get something in the inner city.
That's right.
For them to be, for it to be just right there in the inner
Right.
city. We need something.
Right. And I think that's where I'm going with this conversation. We need something in the city where we can help the inner city, not Kirkwood Highway, but I'm not saying excluding Kirkwood Highway, but it's so much going on in our city. We need our police. We need a building. Y'all have a building. We need some funding to start this up and get it moving and not just talk about it. Let's be about it. We live in the community. We see what's going on. And I'm so glad that you were able to come out from work today, Johnita. Thank you. And thank you, Elosha. I appreciate you
Thanks
bringing
for having us.
supervisor. And I hope this is just one conversation, and hopefully we can have another conversation.
Absolutely.
And I would really appreciate DETV for allowing me to come on and speak about this problem, because it's a epidemic in our community that is really hurting our community. These drugs are killing us slowly, and we need to get some help in our community in Wilmington, Delaware. This is me, Zanthia Oliver, saying we need a place in Wilmington, Delaware, where our people can go and get some help for these issues that we see every day. And I really appreciate y'all coming on, and it's really been a pleasure just to, learn some things about it. I know a little bit about it, I read up on it, but it's nothing like hearing it from the people who work it, live it firsthand. And
Thank you for
that's
having
about
us.
all. That's about it. That's all about it. So I'd like to thank you. This is Councilwoman Zanthia Oliver's show, and I will be back again next week. And I appreciate everybody taking the time and listening to us talk about the fentanyl that's hurting our community, the heroin, and numerous other drugs that are affecting our community. And we need to get ourselves together in Wilmington and get a place here. We need to champion, work on that, and maybe get a petition or talk to the lieutenant. She says she's willing to help out, and maybe we'll discuss that off the air in reference to trying to see how we can go about getting some assistance in that building.